So, welcome everyone to the Africa SiB webinar for September. The focus of today's discussion is really shining a spotlight on the impact that SiB projects have had in two countries. We're going to look at Ghana and Tanzania. And really looking at how the SiB has stepped up eye care services in both those countries. So thank you to our speakers. We have joining us today some fantastic presentations. We have Dr. James Addy, who's head of the eye care unit at the Ghana Health Service. We also have Edwin Meleko, who's a regional project coordinator from Sight Savers in Tanzania. And we also have Simon Day, who some of you might know. He's from IEPB, our Africa Regional Coordinator. Now, so to kick us off, we have Simon, who is, as I said, our Africa Regional Coordinator from IAPB, and he's going to provide us with a brief introduction. Simon, over to you.
Thank you, Neve. Well, comprehensive eye care aims to ensure that people have access to eye care services that meet their needs at every stage of life. This includes not only prevention and treatment services, but also rehabilitation. Comprehensive eye care also aims to address the full spectrum of eye diseases. In order to achieve this, it is necessary to have structured and meaningful coordination amongst governments, international organizations, the private sector, civil society, and across all different levels and sites of eye care delivery within and beyond the health sector. Everyone, everywhere, should have access to quality and affordable eye care services. Health systems face significant challenges in meeting the current and projected eye care needs of the world's population. There's no choice but to take on these challenges. The premise of the World Report on Vision is that integrated people-centered eye care has the potential to accelerate and meet these challenges. Bringing together world authorities on eye health and health system strengthening, the World Report on Vision provides a major opportunity to mobilize the highest political support for eye health. The report comes at a time when there is an increasing recognition that the Sustainable Development Goals and universal health coverage cannot be achieved without eye care. In fact, the World Health Organization has made eye care integral to its plan to achieve universal health coverage, which means that the quality of a country's healthcare system is measured and determined on the basis of its eye care service. Now, this is not just a health issue. In recognizing the important contribution of eye health to the SDGs, the World Report on Vision highlights the close links between eye health and virtually every major issue in development. From education and economic growth to reduced inequality and sustainability. Accordingly, it calls for a more holistic approach to eye health that necessitates a coordinated, multi-sectoral response. The World Report offers clear proposals to address the challenges in delivering eye care. It builds on the concerted efforts of the past 30 years to propose an integrated, people-centered approach that strengthens health systems and meets population needs so that people receive a continuum of promotive, preventive, treatment, and rehabilitative interventions. Now, this is a time for all of us to galvanize our efforts around a crucial set of political messages, and IPB encourages all our members and partners to call on heads of state and national governments who have committed to universal health coverage and the Sustainable Development Goals to take action and ensure universal access to eye health. At this year's World Health Assembly, the Integrated People-Centered Eye Care Resolution was adopted by the 194 member states of the World Health Organization. This marks the next major milestone for global eye health. This resolution transforms the World Report on Vision from a simple document into a political commitment to take action on its recommendations. Its central message, to make eye care an integral part of universal health coverage and to implement integrated people-centered eye care within health systems across the spectrum of services, from health promotion, prevention, treatment, and vision rehabilitation. This resolution is a serious political tool for arming advocates and directing governments to strengthening eye care and eliminating avoidable blindness. One of the biggest barriers to achieving progress in wider health goals is the critical shortage of health workers, the heart and soul of the health system. The eye health sector in Africa is not impervious to the larger health worker crisis and is in fact part of it. The shortage of eye health workers at all levels in sub-Saharan Africa is particularly alarming. For example, the region has less than 50% of the minimum number of ophthalmologists required to meet the needs. In the upcoming webinar, I look forward to hearing particularly how the eye health workforce is being strengthened in Ghana and Tanzania. Mid-level health workers are the backbone of eye health systems, providing vital primary healthcare services, often to rural and remote populations. However, they're often overlooked when it comes to training and development opportunities. I'm keen to hear how this is being addressed in these countries. Thank you, Neve.
Thanks, Simon. That's really helpful introduction, and I think it sets the scene for us as we think about how we can learn, how we can use the learning from SiB going forward, and the challenge ahead in taking the new report for vision forward. So next up, we have Dr. James Addy. So he's the head of the eye care unit at Ghana Health Services. And as I mentioned earlier, he's been involved in SiB throughout the years in different ways. So I think he has a very unique bird's eye view of the impact that SiB has brought about in different ways. So Dr. Addy, over to you.
Thank you. Let me try and share my screen. And let me see if I have this one. Do you see my screen, please?
Not yet, but it sometimes takes a few seconds.
Okay, because I've opened my screen now, and I don't know whether you see it. Do you still see it, or you don't see my screen?
No, if you press the share screen button down at the bottom.
Okay, I've pressed on that one, and okay, there's a share here.
That's it.
It's better? Okay.
Yes.
So now let me go to the PowerPoint. Is it okay now? Yeah, I think
Perfect.
so. Perfect, okay. Thank you very much for this opportunity, and good afternoon to everyone. It's an opportunity for me to share how SiB projects, Seeing is Believing projects, have stepped up eye care services in Ghana. And like you all heard, my name is James Amoadi, Head of Eye Care, Ghana Health Service. I'll give a brief background of the country Ghana, go overview the project activities of Seeing is Believing, and the significant changes that it has brought to the country, and then to share one or two lessons, key lessons that we think other countries and other organizations can take, and probably to help them in their activities. So that would be my presentation outline. Ghana is a member of the ECOWAS country, and from Ghana Statistical Service, our total population now is about a little over 30 million. Of course, the females are more than us. We have 16 regions now. About 2-3 years ago, we had 10 regions, but now we have 16 regions and over 230 districts, 5 teaching hospitals. But then in total, now we have about 9,000 health facilities, and a proportion, quite a number of these facilities provide eye services to the communities and to the population in Ghana. The National Eye Health Program, the aim of the program is aligned with the global initiative Vision 2020, the Right to Sight. And our target is eliminating avoidable blindness by the year 2020. In fact, the government of Ghana signed to this declaration on October 31st, the year 2000. And I always tell people that at that time, I didn't know that the year 2020 will ever come, but here we are. We are in the last quarter of the year 2020. So I'll go over a few of the specific objectives that we developed and for which we think that we are aligned with the SiB project and were able to achieve almost all of them. To the top left you can see that we wanted to conduct surveys to determine the magnitude of magnitude of blindness and visual impairment. We wanted to train and deploy equipment, technicians, the health service providers for an effective and efficient eye health service. And then we also wanted to advocate and support the implementation of integration of primary eye care into primary health care. We wanted to strengthen advocacy for eye health services at all levels. And in Ghana, if we talk about all levels, we have 5 levels: the CHIPS compound, the health center, the district hospital, the regional hospital, and the teaching hospital. So we wanted to strengthen advocacy at all these 5 levels. We also wanted to strengthen cataract surgical service. And in the course of the presentation, I'm sure you agree with me why we wanted to strengthen cataract surgical service. We again wanted to strengthen child eye health services. And the last but not the least, we wanted to improve services for visual impairment and blindness due to refractive errors. We know that in the year 2000, refractive error wasn't among the top priority as far as eye care was concerned. But over the years, now refractive error, especially myopia and presbyopia, is a major concern. And we are glad that it was one of our specific objectives at that point in time. Ghana has been very lucky. We have had 3 phases of Seeing is Believing programs or projects. We had phase 3, phase 4, and phase 5. Phase 3 was done by Operation Eyesight and Sight Savers. Phase 4, Operation Eyesight Universal alone. And then phase 5, Operation Eyesight Universal and Obvious. They are the ones that are working with us as far as SiB is concerned. Now, the major thing that we think we have achieved is the support that we got from SiB for other countries to conduct the first ever national blindness and visual impairment study. And here I'll give some few statistics. From this study, we were able to determine that the prevalence of blindness is 0.74%. And therefore, if you take the 0.74% of the 30 million, you can imagine the number of people who are blind in the country. And then the causes of blindness were cataract, which was 54.8%, actually 55%, glaucoma 19.4%, posterior segment disease, including diabetic retinopathy, 12.3%, and then cornea-related 11.2%. For the severe visual impairment, the prevalence was 1.07%, and the avoidable causes was estimated at 79%. So the support that we had to conduct this first national blindness and visual impairment study actually focused the mind of the whole Ghanaian community, and especially the eye care, in mobilizing resources, both human and material resources, to be able to reduce blindness from 0.74% and to be able to tackle the causes of blindness within the country: cataract, glaucoma, posterior segment disease, and cornea-related causes. So for us, this is a very major achievement as far as SiB is concerned. In the area of pediatric ophthalmology and child eye health, we have had some accomplishment. In fact, the SiB has supported Ghana in the area of training, advocacy, community health education, and eye screening. And in fact, in the area of training, we have had 14 eye nurses and 2 optometrists trained as trainer of trainers as far as pediatric ophthalmology is concerned. We have trained over 420 chef coordinators, 250 community health nurses. But what gladdens my heart is the queen mothers. The fact that we're able to empower the queen mothers. Queen mothers are the custodian of culture within the communities. They are the mothers of the communities. And therefore, once we empower them, we are sure that even any child who is born with an eye condition, either blindness or visual impairment, the queen mothers will facilitate that these children should be sent to the hospitals. And even for older age groups, if there's any problem with the eyes, these queen mothers can advise them for them to go to the facilities, or they can even arrange for the eye health personnel to come over to their communities to come and help the community members. So for me, empowering the Queen Mothers is one of the things that really gladdens my heart. In the area of advocacy, we were able to work with SiB and IAP to generate indicators, and these eye health indicators has been incorporated onto the DAMES2. DAMES2 is the District Health Information Management System. And on this platform, wherever you are in the country, you can click a button and you know how each facility is doing as far as eye care is concerned. Last year, we're happy to have been visited by the Flying Eye Hospital, the plane, which is a tertiary hospital. And of course, that brought a lot of awareness, and actually it was an advocacy for us. They came in and supported our eye care personnel in the area of subspecialties, in the area of cataract surgery, retinal surgery, and others. They trained ophthalmologists, ophthalmic nurses, optometrists, and then the opticians. Some of them were able to assist surgeries on the plane. Some also listened to lectures also on the plane. So that created a lot of awareness within the country. Of course, the political elite were not left out. The Minister of Health, the Minister of Aviation were all there. They came and visited us, so we were very happy. Community health education, we've empowered over 33,000 people. We have screened a lot of school students and school children. 41,000 screened at the primary level, 39,000 by shared coordinators, and 9,000 at the district hospital. But because of this success of the screening of the children, the government of Ghana has taken it up, and now we are screening all children who are going to school. In fact, we started with the free senior high school. Those who are in senior high school, we screen everybody, because we think that if you are getting access to free education, then we should support you. If you have an eye problem, we should support you for you to be able to make maximum use of this opportunity. So now all the students, all the 3 streams, SHS 1, 2, and 3 have all been screened. And therefore, the next 3 years, all the children who are going to the universities, we have a fair idea of the visual condition that they have, and we can support them. We have extended it to the lower level, the basic level. And last year, during the school academic year, all the children who entered kindergarten and class 1 have also been screened. So now we know that children in school have all been screened, and we have a fair enough data to be able to see who and who we can help as far as eye care is concerned. So with this particular, we say that there has been strengthening of the Ghana health system. And then, of course, that has led to the promotion of uptake of child eye health services across the country. Again, it has improved school performance of the children who were identified and then treated. And because the schools themselves have seen the improved performance of the pupils, the schools themselves are now continuing to screen independently with very little support from the health system. So for the eye health and then pediatric ophthalmology, we think that SiB has really set the pace for us, and we have taken it on from there. In the area of financial support, SiB has supported over 35 partner hospitals with an equipment. By equipment, I mean slit lamp or the operating microscopes, indirect and direct ophthalmoscopes. They have provided to these facilities. They've also supported the schools that trained ophthalmic nursing to move from diploma awarding institution to a degree awarding institution. So all the people who are going through the school are now coming out with Bachelor of Science in ophthalmic nursing, which for us is a very good thing. And then again, they've helped us to renovate some old existing eye units. They've helped us to construct new eye units. And the picture that you see is one of the eye units that have been constructed. They funded outreach activities. They've supported IE&C materials. And then, of course, in this COVID area, SiB has also supported us to provide PPEs to the facilities that are providing service in order to protect the eye care staff. In the area of eye health workforce, they've built the capacity of 21 optometrists in the area of low vision, because from the national survey that we did, where we realized that low vision is also a major problem. And we can agree that some children will be born either blind or with low vision. Again, our other people with glaucoma, some may end up with low vision. Other people with retinal conditions, diabetic hypertension, sickle cell disease, and other related retinal conditions may end up with low vision. So we wanted to build a low vision service, and we got that support to be able to do that. Over 71 ophthalmic nurses were effectively trained in the use of basic ophthalmic equipment. When they were going through school, they didn't get opportunity to use the slit lamps. And after they left school and they were posted, they were given slit lamps. And you go to the facility and realize they have covered it nicely and they were not using it. So we had to get the support to go back and one-on-one train them how to use the slit lamp. And for me, that I know that that will improve diagnosis, that will improve management, and of course help to reduce blindness. They have supported equipment technicians so that we can have the full lifespan of these equipment that we have. Of course, primary eye care training is continuing. And all these things contributed in improving service delivery. In fact, in one of the phases, over 20,000 surgeries were done, 1,000 spectacles were dispensed. And for me, the 5 million Ghanaians were educated to be able to take charge of their eye health. And that is very, very important. Once they take charge, then of course we are sure that if they need to come to the facility, they will come themselves. If they need to refer other people, they can also help refer these people. In the area of health information systems, again, SiB and IAPP help us to develop the indicators, and this was populated on the DIM. So wherever you sit in the country, you can click and know what the facilities are doing as far as service delivery is concerned, as far as data entry is concerned. And we can also decide that where there are challenges, we can quickly go there and go and help them. Essential medicines have been provided to the partner institutions and across the country. All these things have built sustainability in eye care in the country, right from integration of primary eye care into all health activities. And like I said, all the 5 levels that I talked about, and also the introduction of the eye health indicators into the health management information system. Now there's transparency. Whatever service that you are providing, once you enter the data, from wherever we sit, we can have access to the data. So these things have really, really contributed to strengthening the eye health system in Ghana. And for us, we think that this is a very significant change as far as SiB and is concerned. Have we learned any lessons? Yes, we believe that for proper planning, stakeholder engagement is key. If you want to be successful in your programs or in your projects, stakeholder engagement, stakeholder engagement, stakeholder engagement. And because we are working with the financial sector, who says that the banking system and the financial sector are not interested in eye care? So long as they are stakeholders and you involve them. Standard Chartered Bank was part of SiB. And of course, the local Standard Chartered Bank has been fully engaged as far as eye care is concerned in Ghana. They have been participating in project activities, including even the World Sight Day. During World Sight Day, they will come out and then they will go on a route march. They will be part of the screening program. They will be given what they call speeches here and there. In the communities where they have branches, they also supported those branches to be able to get to the people in those communities. So financial sector is very much interested as far as eye care is concerned, and Standard Chartered Bank has done a lot of activities as far as SiB is concerned in Ghana. So for us, these 2 lessons for us think that any other organization or any country who wants to work with these institutions should be able to remember stakeholder engagement, stakeholder engagement, and stakeholder engagement. And of course, the financial sector is ready to support eye care in every country if you engage them properly. Thank you very much.
Thank you, James. That was a really interesting presentation. So thank you. I think you gave a really comprehensive overview of the changes brought about by SiB in Ghana. Thank you for highlighting the work done to empower the Queen Mothers as well. I thought that was really interesting. And also for highlighting the National Blindness and Visual Impairment Study. I think investing in evidence and data generation has been an important contribution that SiB has made to the eye health sector. And just to note, that national study is available on the IEPB website, along with other types of surveys and RABs and stuff. So please do check out those resources for those of you who are interested. I'm going to now introduce our next presenter, who is Edwin Meleko, who's the Regional Project Coordinator from Sight Savers in Tanzania. and he's going to speak to us about a project that has contributed to the sustainable provision of eye care services in 7 districts of Singida region in Tanzania, and focusing on demand creation and improvements in current delivery mechanisms. So Edwin, over to you.
Yes, thank you for the introduction. Basically, I can introduce myself as Niam said. I'm Edwin Mareko, working for Site Savers in Tanzania, specifically in the implementation of the SiB Living project. Maybe to start, this project has been implemented since 2016 in one of the region in Tanzania called Singida, a central part of Tanzania. So it was really a very comprehensive project, I can say, focused on all areas, all WHO 6 building blocks. Yeah, you can move to the next slide. Maybe. Yeah, the project goal implemented in a central part of Tanzania in 7 districts of Singida region, goal was to contribute to the sustainable provision of eye care services in 7 districts of Singida region in Tanzania, focusing on demand creation and improvement of current delivery mechanism. But we had 3 objectives, mainly to ensure increased support and commitment to eye care health from local to central government. That means from district level or from the lower level facility to national level, but also strengthening eye health system to deliver eye health service in all 7 districts of the Singida region, as well as to ensure men, women, and children with visual impairment access quality health services in 7 of the Singida region. Yeah. Going to areas of intervention, as I said earlier, this project was very comprehensive to build a case like in the country. But areas of intervention focused on awareness raising, mass mobilization of and service delivery. In the region, we have about 428 villages, and the population is 1.6 million. Currently is 1.6 million people in the region. So we had awareness raising campaigns, but also surgical and treatment outreach service in all districts, not at district level, but also at the lower level facilities, but also refurbishment and construction of eye units and equipment provision. We had to conduct studies, gender and lab studies, but also another area was training to mid-level eye personnel and primary healthcare workers, but also to support the region to have a sustainable eye health financing mechanism and advocacy for eye care services, but also to lobby and influence the policy development when it comes to supporting eye care service delivery. But we also had the midterm and final evaluation for the project. All these are were the main areas of the SiB project in Tanzania. So we are moving to what we achieved for the previous 4 years. When it comes to human resource for eye health, the SiB project in Tanzania trained 4 assistant medical in ophthalmologists. They attended 2 years training. And also we trained the ophthalmic nursing on eye health. We trained also HMS staffs were trained on how to collect and analyze eye health data within their department. So we trained 16 people in the region, but also trained 1 person on low vision. The optometrist was trained in India so that she can come back and provide low vision service in the region. But also we trained 298 primary healthcare workers who are working at dispensary and health facility. These are the primary health provision centers. So we train them so that they can refer people and they can conduct early diagnosis to ensure that we integrate primary eye care with primary healthcare services in the country, but specifically in Singida. But also we had to we constructed 5 eye units constructed in 5 districts. Before this project, we had only 1 center conducting cataract surgery in the region. So with this project now, we constructed 5 in 5 districts, so to minimize the distance and ensure that the referral system is well equipped, but also we provided the equipment to ensure that they provide comprehensive eye care services. As the result, we can compare before this project in 2015, the region had the capacity to conduct only 531 cataract surgery, but up to June this year, they are able to conduct 2,160 cataract surgery. So you can see the growth rate of conducting cataract surgery in the regions. All these are the result of having a comprehensive project, SiB project in the region. But when it comes to the number of people screened, before this project in the region, have a capacity to screen only 15,000 people, but so far it is 28,000 people annually. So you can see the improvement, the number of people who receive eye screening. But also before the SiB project, you can see when it comes to screening of children, we know that the government have a system, but when it comes to primary school children, aged 7 to 15 to 13 years, before we had no school screening program, but with the SiB project now we started to screen children, and we reached a lot of children to screen after training primary school teacher. We trained primary school teachers, 1,051 trained. Then they are the one who conducted the primary screening to identify eye disease. Then after quickly identify especially refractive error for children. Then we supported eye care staffs who are professional optometrists and ophthalmic nurse and AMOs to go and screen these children to ensure that to identify if they have real problems and support them. So we reached a lot of children in schools, but 10,665 were dispensed with spectacles. So you can see out of the 2,100, 10,000 received spectacles to improve their vision. All these were contributed with this project. Yeah. Going to another slide, you can, when it comes to supporting the country, not only Singida region, but the country to have evidence. Since I can say previous 15 years, we had only 1 RAB study conducted in 1 region of Kilimanjaro in Tanzania. But with the SiB now in Singida, we conducted a RAB study to have so that the region or the country can have a very good baseline, what to be done in all areas when it comes to eye service delivery. So the RAB study were conducted in 2017. Now it is not used only by site savers, but also the country-wise. They use the study to very good when it comes to recommendation and also learnings from Singida. But also we conducted a situation analysis to focus on eye health financing to assess challenges for sustainable eye care service in the region. And we came up with the recommendation in the way forward to ensure that the region sustain eye care services. And now it is well integrated to the health system in the region. But also we had gender issues, gender challenges of reaching women. You can see we had a RAB study indicating that we need to reach more women, about 65%. But what are the barriers? Is it accessibility, affordability, awareness, or what? So the gender study were conducted through the SiB project, and it came up with very good recommendation from the community, from the beneficiaries. So we have already shared with the government to take it forward to ensure the recommendations are well integrated to other plans. But also we had mid-term evaluation and end-term of project evaluation to come up with what we learned, what need to be taken forward by the government, and the next designing program design of the same natures. So that is what we conducted when it comes to studies and the evaluation of this project. So we have a lot of lessons learned generated from the SiB region, and I can share with you in the next slide, you can see. From all the lessons and the service delivery and the trainings, we learned a lot, and we have already customized, we have already come up with a report to the Ministry of Health. But specifically, we learned that the need of integrating primary eye care into primary health care, because now the region get referral from primary health centers after training the PHWs. But also when it comes to the sustainability, the eye health financing strategy recommend on the integration of eye health with insurance schemes and the cost sharing, because SiB invested a lot of money in the region, but how can they sustain? So the recommendation from the start came up for the region to ensure they integrate eye health with insurance schemes, to ensure also patient sharing costs, but also the issue of direct out-of-pocket payment from patients. But also we trained the region after the eye health financing mechanism. We trained the health teams on income tracking mechanism at eye department, so that to ensure they, whenever they collect a revenue from eye care service delivery, they record and they go back to their health managers to demand the amount to be revolved. But also from the program, we advocate, but we learned that eye drugs and equipment are still missing from medical store department and not vendors at the region. So this was learned, and we communicated this to the Ministry of Health, and good that even yesterday we heard that the upcoming medical store department catalog will include all eye care drugs and equipment. So that is a very good achievement when it comes to the advocacy side. So we learned, and we communicated with the ministry and the decision makers. But eye screening to be done for all pupils before joining for primary school. You can see the number of children who receive these spectacles. So it is a very big number. But from the implementation and the evaluation, we recommended to the government that they must make sure that they screen children, not only in Singida, but in the country, to ensure that they test eyes before joining schools, but also appropriate sensitization to parent and school management teams need to be conducted. When it comes to all these school screening programs, we must make sure that parents are aware on eye health for their children, otherwise they cannot support. But more resources required to implement the recommendation, so we take what the government through advocacy. Yeah, I can share with you the last slide. From the advocacy side, because we had a lot of lessons learned from the region and the implementation. You can see in the table the allocation of financial resources. In 2015-2016, the whole region in Singida had only 6 Tanzanian shilling million, 6.6 million in the first column. But you can see 2018, 2019, 2020, it is 42.3 million allocated. This is due to the advocacy work done through the health management teams at district level, regional level, to ensure that they start to allocate funds for eye care services. The allocation and the spending, and when it comes to spending, is somehow different, but good that with the sustainable eye health financing mechanism developed to ensure they recover cost, the staff have capacity to track income and revenue collected from eye care service, but mechanism for ring-fencing eye care service revenue. You can see in the example below. In 2019-2020, the regional collected 51 million, where they allocated 41. This collection comes from the patient who visited the eye care clinic during either outreach or static health service. So the sustainability will only be possible if a patient can use revenue, they can use, I can say, health insurance their cards, but also contribution when it comes to buying of spectacles, cataract surgery. So we'll only sustain this service if we insist on cost sharing and the integration of insurance schemes. Yeah, that is what we recommended to the region, and it has been taken forward with the government. And they are happy because the 51 million have been only contributed with very few patients, I can say. Not all patients who managed to pay, or others had no insurance cards. But now the government will continue to sensitize people to ensure that they have insurance cards so that they can be able to sustain eye health services in the region, but in the country generally. Yeah, that is what we learned when it comes to sustainability aspect and advocacy. Next slide, please. Yeah, at the end, I can just recommend, when it comes to the advocacy, now the very big success, with what was learned in Singida was also taken forward with the Ministry of Health. The National Eye Care Strategic Plan now includes a lot of lessons learned in Singida, and it is part of the 2018-2020 National Eye Care Strategic Plan. But yesterday we received a message from the Ministry of Health that they will also incorporate lessons learned from the SiB project in Singida to the wider National Health Strategic Plan 5. So they are currently developing National Health Strategic Plan. Previous, they had no eye care clause in the plan, but now they will take this forward so that to complement what have been achieved through the SiB project. Thank you for listening, and it is the end of my presentation. Thank you a lot.
Thank you, Edwin. That's really good. And it's so encouraging to hear the successes you've had with the advocacy and with the government increases in financing for healthcare and for eye care. So it's really interesting. And the work around the strategy on sustainable financing, I think that's really critical as we think about the sustainability question going forward into the future. So thank you to all our presenters today. Those are really interesting presentations. I'm going to open up for questions. So please feel free to put some questions in the chat box if you'd like to ask James or Edwin or Simon any questions. We'd be very happy to take to hear from you. We have one question already that's come in, and from Irene Calvo, who's saying, and this is for you, Dr. Adi, really interesting. I'm wondering, how has the Ministry of Health been involved in the implementation? You're just on mute at the moment.
Thank you very much. And the Ministry of Health actually has other agencies, and the Ghana Health Service is the leading agency when it comes to healthcare. The ministry has been very much involved right from the beginning. For example, I told you that the declaration was signed by the government of Ghana on October 30th, the year 2000. So committing the whole country to the process of eye care. When it comes to the training, in the area of training, the area of service, we need to apply through the Ministry of Health. And the Ministry of Health actually facilitates things for us at the regional level, at the national level, and then at the district and community level. So Ministry of Health has very, very much been involved in everything. And we do a performance review with the Ministry of Health, so they know exactly how far we have gone and the challenges that we are facing. The minister is also involved in, these are just the SiB programs, but then there are other programs that also really brings in the minister. For example, maybe let me chip this one in. Ghana has eliminated trachoma. I mean, the first country, sub-Saharan or sub-Saharan Africa, to do that. And we couldn't have achieved that if the ministry wasn't very much involved. So the ministry has been very, very much involved. In fact, for the Flying Eye Hospital coming down, it actually came all the way from the presidency. I mean, the presidency was giving direction. He was briefed at any point in time as to how programs were going. So yes, the ministry is very much involved, and even the government is very much involved.
Great. Thanks, James. Please feel free to, if you have any more questions on the side, please put them into the chat bar. I have a question whilst we're waiting for others to come in. It's just one, if you could name one thing that you do differently with SiB funding, if you could do it over again, what would that be?
For SiB funding, in fact, I think basically our also will be, I'll push it more in the training of ophthalmologists, because that is one area which basically they have to sponsor themselves. I would say that now is better, but I still think that if you have had enough money and we'd have supported a lot of the doctors, or almost all our hospitals and facilities definitely would have them in place, because now we have quite a number of general ophthalmologists, but now we could have moved into specialties in the area of anterior segment specialty, in the area of retinal surgery, because that has lagged behind when it comes to the posterior segment diseases. So if I have SiB funding now, I'm sure I'll get as many doctors as possible and send them to school. That's exactly what I would do.
Great, thank you. Thanks. We have a question come in for you, Edwin. Can you share some successes of the program in relation to gender? And this is from Alice Mwangi in OEU in Kenya.
Basically, what I can say, because the gender study was conducted this year, early this year. Previously, I can say the issue of attitude when it comes to the community behavior. We implemented the program, and previous women were not coming up, showing up during outreach, I can say. They showed up, but when it comes to cataract, most of women were not found for cataract. We screen a lot of women, but when it comes to cataract operation, it's like they are not accepting. But also the issue of cultural aspect, and when it comes to the general community behavior and the accessibility, affordability, all these were areas first the women to accept cataract, because they are the one who produce a lot when it comes to taking care of children, domestic work. But this gender study informed us when it comes to working, to designing the project, we must make sure that we collect feedback or views from women. So that is the turning point. But also not only working with men, but also working with women, but also working with men who are the one who hold the household income. So that is the area we think we have extracted. And the gender study, this very big success is for the government to accept it, because now the government have accepted, and good that today we had a meeting with the ministry, and the director of social welfare said we need to take forward the recommendation from the gender so that can be part of a wider Ministry of Health. So you can say, so it's a very big achievement, I can say, when it comes to informing the government. Otherwise, we had no such kind of start. So I can say it can help going forward. Yeah.
Great, thanks, Edwin. And actually, there's a related question to that from Irene, which is just in terms of the involvement of the government in Tanzania in the implementation of the project. What did that look like for the implementation phase of the project?
Yes, thank you. When it comes to planning and designing, we involved the district partners, the 7 districts. We have district medical officers. They are the one who oversee the overall implementation. But every year when the government start their annual planning, we also participated so that to influence. So we provide them what the program need to achieve and where we need to focus during the specific year. So the government participated in planning, but also when it comes to advocacy, we collected feedback from the district to take them to the Ministry of Health for support, especially when it the types of building required. And good that before this project, the government had no construction drawings when it comes to eye care. They had only one room, single room. But with the construction of the 5 units, now the government have taken it forward. They have designed a standard drawing for eye health. So you can see they involved from district to national level during the advocacy meetings. Yeah.
Okay, that's really good. Thanks, Edwin. And I'm just going to take one final question, which has just come in from Dr. Bowiaf, which is one of the recommendations, he says, from the Singida region is the integration of PEC into PHC. Can you please share some details of some of the challenges you faced?
Yes, thank you. First is the challenge come during the training colleges where PHW are trained because they are general PHW. But the training manual or training course does not intensively include eye health services. So that is a challenge. So I know that we had an ON project supported with the SiB, I can say, supported the Ministry of Health to have such kind of trainings. So it was a challenge. So we trained them, they go to the community, to their facilities, but it is like separated with the government systems. So the challenge comes to the training institutions. They must include it. And also when it comes to the planning cycle, PHW must also be involved, directly involved, those who have been trained to the planning so that they can include maybe when it comes, they need some kind of equipment, small equipment, support primary screening. So that is the challenge around. But yeah, it was a very good lesson, and we have taken it to the government that you need to include this, and they are happy with the another ON program supported with SiB. They have scaled it up to the ministry for action.
Great, thanks, Edwin. Thanks for answering all those questions, and thanks to all of our speakers today. That was really interesting from my perspective. I'm just going to hand over to Sally Crook now, who is the SiB Program Manager, just to kind of give us some concluding remarks before we end the session. Sally, over to you.
Okay, well, thank you very much. And thank you so much to our two presenters. I found this really interesting today from sort of opposite sides of the continent. But I really do feel that Seeing is Believing has moved both countries onwards a little bit in different ways. Because as Dr. Addy said at the beginning, I think one of the real sort of standout points for me about Seeing is Believing is we have been able to try and align ourselves with the country plans, the direction that the country wants to go in. And I think it is this sort of incremental building on what is there, what is needed, and how, you know, you can support how the country is going. So Irene's question of how do we involve everybody, and certainly Dr. Addy at the end, you again were saying, you know, stakeholders, yes, everybody needs to be on the same page. You need to talk to them, discuss it, and really plan carefully what you're going to do if you really want to get a good result. And certainly from your presentation today, I did get some really good learning. I loved how you also talked about the Queen Mothers and how they can be really influential in the communities and help people to maybe change their behaviors or take the new information they have and use it and things. And also just how having, you know, you managed to do a whole national study, that once you have this information, it really helps the planners and the policymakers to really drill down and get their plans, you know, in place and get some numbers in there and really look at what's possible. And then, you know, thinking about Tanzania, where again, Edwin, you know, this is a sort of a region that's sort of now been assisted over several projects. So we've been able to sort of build up, because I remember the first project, we couldn't include the children because there's always that problem of, do you stretch your money really thinly and trying to, do comprehensive service delivery? Or do you say, no, this money can only stretch this far? And then, we managed to find some more money for another project to include child health services as well, and looking at the more refraction end of things. And that's it, that, you do need to have a significant investment in any area to make any significant change. But again, I would say from Tanzania, what I take away from that is, again, it was the RAB study, because it was only really from the RAB study that it threw up that, the need of women was so unmet. It was 65% of the need was women, because they were not having their needs met and things. And therefore, you were able to then look at, well, even after these years of, service delivery, why are we still not being able to persuade the women to come forward and things? So I think, it's having the data again. You need to then slowly build up. And the other thing, I would encourage people to look on the Seeing is Believing page of the IPB website, because the situation analysis on the health financing, and it's looking at the challenges as well as the sustainability for eye care services, using Singida as a sort of a case study. And for me, again, that study is really informative about how you need to, again, going back to Dr. Addy's point of involve everybody and look at what direction is the health service going around, especially around financing and sustainability. And I think in lots of African countries, I've seen trying to fit eye care into the health insurance systems and things has not been plain sailing anywhere. And there's lots of learning about what does this mean for the staff at the health facility levels? What does it mean for the community, and understanding about the health insurance and things? And I think in this study in Tanzania is a really honest and critical appraisal of how does it actually happen, and what are the the pitfalls that you might come across as you do it. So again, I think it's been great that Seeing is Believing has been able to fund these studies so we can capture all this. So whether it's a survey in Ghana or a great situation analysis in Tanzania, I think these have all been great learnings so that the countries can really interrogate what's going on there and how can they improve services for the future. But I do feel for both these countries, things have improved, have moved on, and there's been some great achievements and great learning. And thank you very much to you and all the staff who've been busy in your countries working on eye health, because it's a lot of people who have to deliver to get quality services out there. Thank you very much.
Thank you.
Thank you, Sally. Thank you. So that kind of brings us to the end of our webinar. That brings us to the end of our webinar today. So I thank you for your time. Thank you to Holly for all your technical support today. And thank you to everyone who's participated. We really appreciate you taking the time to be part of our kind of SiB learning community. Some of you might have already seen, but in the last SiB newsletter, we are organising a programme closing virtual event on the December 1st. So please do save the date. It's kind of the last opportunity for SiB partners to come together to celebrate successes and share learnings and discuss opportunities for a potential future collaboration. So again, I'll just finish by saying thank you to our speakers, and I will just, after this, we'll send you a quick survey. We would be really grateful if you could just spend 5 minutes completing it. It just helps us to improve our experience. And so thanks to all, and have a great rest of the week.